Hello everyone and welcome to my poster presentation titled The Risk of Recall Among Orthopedic 510K Devices. My name is Jacob Williamson and I'm one of the medical students who had the privilege to contribute to this project. Just briefly to begin, the Food and Drug Administration has been responsible for supplying and maintaining the safety of medical devices since the mid-1970s. And they do this through issuing recalls on devices that they have agreed that are unsafe or otherwise inept. Additionally, the Food and Drug Administration is responsible for accepting devices through one of two pathways. One pathway is called the pre-market approval pathway, and this pathway requires significant clinical testing and proof of concept before a device will be accepted into the market. The other pathway that the FDA uses to approve devices is what's called the 510K pathway, and this pathway requires no such testing and must only prove substantial equivalence to existing devices based on biomechanical analysis. So they really just have to prove that the device is similar to one that's already in existence. What's interesting in our research is we found that 90% of orthopedic devices reach the market through the use of this 510K pathway, so not being required to prove that the device is clinically safe. Only having to prove that it's similar to an existing device. Additionally, we found that orthopedic devices make up 41% of total FDA recalls, and this greatly outnumbers other specialties, the next closest being cardiology, which makes up only 9% of total device recalls. As we continued to research, we found that there were no studies that really evaluate the risk of recall in 510K devices specifically. Additionally, there's no study that proves what the risk of a repeated recall is in these devices which are recalled once. And then finally, we conclude that surgeons should know this information to better counsel their patients when selecting a device for surgery. Moving to our methods now, we queried the FDA's 510K database for orthopedic devices between the years 2008 and 2017. And this resulted in 5,376 medical devices. We then grouped these devices based on their subspecialty. These included spine, large joint, medium joint devices, small joint devices, and devices labeled as other. We then continued to look in the database for those which were recalled, and then we were able to gather more information based on the reason for recall, the date of recall, multiple other things were able to be found on the 510K database. We then recorded those into an Excel sheet and performed a chi-square test to determine the number of recalls that we could expect based on the percentage of total devices that a subclass made up. Moving now to our results, after we performed that chi-square test, we found that 579 devices were recalled. That's representing 10.8% risk of recall. 130 of those devices were recalled at least one other time, and this was significantly increased from the baseline risk. We then found that 18.5% of large joint devices and 10.6% of medium and small joint devices were recalled, and these were both higher than what we would expect based on how many devices there were in that category. Spine devices were the only group of medical devices that actually underwent recall at a lower than expected rate. And then finally, we weren't able to conclude that there was a significant difference between the groups and the reason that the device was recalled. You can see the expected versus the actual number of recalls represented in blue and orange on the bar graph here respectively. To summarize, we find that an initial recall correlates to a significantly elevated risk of at least one other recall. And then despite making up the highest number of orthopedic devices, spine devices actually had a lower than expected rate of recall. And finally, large, medium, and small joint devices underwent recalls more frequently than expected. We can draw a couple of conclusions from our results, and the first is that there's a baseline risk of about 11% for orthopedic devices approved through the 510K pathway. We recommend that further investigation be undertaken in each specialty to identify risk factors for these recalls, and we recommend that the FDA pursue a mechanism to address the root cause for device recall so that this increased risk of repetitive recall does not continue to happen. Finally, the limitations to our study were twofold. One is that a recall is really a limited scope on device safety. This doesn't include the pain and suffering that patients would undergo should a device suffer a catastrophic failure. And finally, some unsafe devices are not actually recalled, but the FDA will issue kind of a warning statement or issue an announcement to the manufacturers and to physicians. So thank you all for viewing my poster. Thank you to Dr. Dubin for allowing me to contribute to this project, and to Daria, my colleague, who contributed to the project, and Dr. Chang, who performed the statistical analyses for our project. Thank you.